Thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 50 to 60 minutes speaking of an invaluable tool that you have as an agent contracted with our organization to help you maximize your time and your sales during AEP, where time is a major consideration, but it's a valid tool to use year-round, and I think you'll see the value of it yourselves as we go through the presentation. Today's presentation is being recorded, and it will be posted to our website at premiersmi.com and on our YouTube channel as well, but will be sent by email to everyone who expressed interest in today's webinar. You'll notice in the software package that there is a section that speaks to questions and chat. We ask that you put your questions logically in the questions box, and we find normally that we address them throughout the course of the presentation, but we want to make certain that we get you the data you need in order to maximize the value of your time invested in today's presentation as well. So watch for that, and we'll begin with a bit of level set about our organization. Premier Marketing is a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform. We have offices across the country providing insurance services to the public through independent insurance agents such as yourself. And we offer contracts at the highest possible commission levels with recruiting contracts available to those who qualify. Those offices across the country in our organization, well, we are in all 50 states as well. We offer these programs through a full portfolio of products that include the basic Medicare programs, the Medicare Advantage, Medicare Supplement, and standalone Part D programs, but also a full portfolio of life insurance and annuity products, final expense life insurance, pre-need plans, long and short-term care programs, disability income plans, and those ancillary benefits that are obviously, well, many times a shortfall with the basic medical coverages that you have under Medicare. And they include the dental, vision, hearing products, critical illness cancer plans, hospital indemnity programs, accident programs, and even a telehealth program called MD Live. You'll see where many of these programs are part and parcel, integral to today's topic with the software systems that we're going to show to you again today. The Medicare Advantage programs do include all the national carriers and many of the strong regionals that make a difference for you in your market. And that same philosophy carries over into the prescription drug plans where they're available to you through our organization as well. You'll find that in the vast majority of these systems, well, hey, they're mostly available through the same contract that you fill out for the MA plans anyway. The Medicare Supplement programs, we have a hearty selection of programs there for you. We want to make certain that you're able to address the needs of all the Medicare beneficiaries, regardless of income and the programs that they have in order to be fully covered throughout the year. The ancillary products in each of the categories, the national players are there for you. And so we want to make certain that the shortfalls and the basic coverages come into play and are available to you there too. When we speak of the Medicare opportunity, you hear of the aging of the baby boomers, the silver tsunami, 1 every 10 seconds, 10,000 plus a day. But if you look at the Medicare demographic as just folks 65 and older, you're a little off in the size of the market because we're seeing an increasing number of people who are working past the age of 65. Some of that's been influenced by the pandemic over the last year and a half or so, but also because in many circumstances, people choose to work past 65. And many of the folks are continuing to do so because they want to make certain that it kind of coincides with the full benefit they can file for with Social Security. So I say all that because that whittles down that number, but we have 15% of the Medicare population that's under the age of 65 and more than make up for those folks that aren't immediately accessing all of the Medicare benefits that they are eligible for. This is an important point for today's presentation because many of the programs that are offered through this software system, well, they can be applied to the folks under the age of 65. And that's important because the Medicare population has some challenges. 2/3 of them have 3+ chronic conditions. Many of them have challenges with their income and their assets. And so if we have a full portfolio of products, we can properly address the needs of the folks we visit with because they've got choices. People, when they come into Medicare, if they wanted to, they could decline the optional Part B. Thankfully, vast majority of them don't. Some of them will self-insure for the medical portion and pick up the Part D plan to help with I should say, the expenses of the medications, but also a large number of folks will take out a standardized, modernized Medicare supplement plan, a Medigap plan, and then other folks will, as they say on the TV shows, they bundle. They will put in for coverage through the Medicare Advantage plans, also known as Part C programs. That's important because as we see people come into the Medicare systems, well, it's a pretty even split as to what they're choosing between Medicare Advantage and Med Sup plans. Both of them need help across the way with delivery of information, but also with the ancillary benefits to help them. And we see that portion that says Medicare Advantage or original Medicare only. This will include the dual beneficiaries, the Medicare and Medicaid folks that aren't on an MA plan. It'll include folks that are accessing care through the VA, TRICARE for Life programs, people who are accessing benefits through a retirement program, and that portion of the population that chooses to self-insure. So across the board, we want to make certain that we can not only deliver the benefits that they need, but also a manner in which we can deliver the information they need in the manner that they choose to access that information. So in order to do so, we also have to be prepared to answer their questions. And a lot of them come up with, well, what's that mean? MSP, MOUSE, whatever it happens to be. Well, we want to make certain we're able to translate and speak to them in a language that they understand. And it's very easy for us as insurance agents to get into our acronyms and assume people know what we're talking about, when in many cases they don't. We also have to deal with the different election periods because a lot of the MA carriers have come out with, well, all of them have, with their benefits for 2022. Sometimes we look forward to that annual election period from October 15th to December 7th, when we realize too that a whole bunch of us, well, we need to make certain we are working the SEP programs, acronym, special election periods, in order to help people through the course of the remainder of the year. And we need to make money during that time period as well. So we'll work the SEPs that are available that include the standard ones and the ones caused by weather or other means, because folks aren't looking at the coverages they have. Kaiser Family Foundation tells us that the majority of Medicare beneficiaries don't review or compare their coverage annually, and there's a number of reasons for that. They may find it more challenging to understand the information, and a lot of the folks that are particularly vulnerable really need our help in that area. So we need to be able to deliver it because they're not understanding what is out there available to them, or even using Medicare's official information resources. For those of you that haven't heard, they're tweaking the Medicare Plan Finder again this year. So it'll be interesting to see how some of that flushes out and how we can deliver upon the information they need to make a solid choice moving forward. Because that Medicare Handbook that's sent out, the Medicare New Book that's sent to everybody that's on Medicare during October, well, either electronically or through the United States Postal Service, you've seen those. That's a good alternative to Somnex or Unisom to read through the whole thing. They're not using the app that's out there available for them. They're not even using some of the, I will confess, some pretty good videos that are out there put out by the government. So we need to make certain that we're able to deliver that information to them in a manner that gets to them either virtually or in person, and be prepared to pivot between those, because in many circumstances, visiting with someone in person, particularly if you're working in retail or telephonically, it may have a face-to-face appointment with follow-ups done virtually. And we've trained them, we and everyone else in the world, in accessing those pieces of information they need electronically. Doctors for over a year saw their patients electronically. Specialists have done it. Hospitals are doing a lot of the prep work that way. Even dentists are in the game and making certain that we use digital means of collecting information as quickly as possible. Hey, churches, synagogues, mosques are having services online. So they're able, in many cases, to be much more proficient and accessing the benefits that they need because, hey, they're not accessing the systems that are out there to identify their choices and options. So we need to help them. And we're doing so within our organization and our partners within the Integrity platform through the MedicareCENTER program. It's a great way to access things all through a universal login that has access to 3 different quoting engines. It gives us also the opportunity to make use of a simplified and enhanced CRM. So we have client management tools available through that system that allows us to work year round and go back and speak to folks that we saw last year. And it gives us then the opportunity to look at one of the 3 tools that's part and parcel of MedicareCENTER that can be critical to your success moving forward. And that's the CSG actuarial tool that we have available. So we've asked our friend Anna Patrick to come on and help us with the information that is necessary to understand that system and one of those key components. So at this time, I'm going to turn the helm over to Anna and ask her to, hey, Anna, take it away.
Perfect. Thank you, John, for having me here. And thank you for all of you who are here on the call. It's always a pleasure getting to speak with agents live. And really what our focus is to help you be successful this AEP. And a lot of what you saw is how can CSG help you maximize your efforts and really save you time during AEP. So as John mentioned, you do have full access to our suite of tools that are inside MedicareCENTER. When you sign into MedicareCENTER, underneath the MedSup button is where the CSG actuarial software is all housed. So it doesn't just have MedSup, it has a variety of other software features that can really help you be successful this AEP. And most of you, I hope you are familiar with how our quoting platform works. So I'm not going to spend much time going over the older version of the quoting. I more want to spend some time on some of our newer features that you have access to. But all of these newer features are still part of ways to help you maximize your efforts during AEP. So I'm going to cover a couple of different things. One is I'm going to go over this MarketEdge tool. MarketEdge is a component that helps you break down Medicare demographics. I also want to show you options for doing bulk quoting. This works on the Medicare supplement side where you can run multiple quotes at one time. And then I do want to dive into our e-application platform too. We just launched United Healthcare on our e-app, so this allows you to take an application straight on the quoting tool and submit that business directly to United Healthcare. So that's kind of what I'm going to focus on here, and if time allows, I'll dive into some additional features as well. So I'm going to start with MarketEdge. As I mentioned, this is a tool that they can help break down Medicare demographics and really help you pinpoint these areas of opportunity. So when you click on MarketEdge, you can select a state. I'm going to use Texas here as an example, but you can put in some quote parameters. Another component of MarketEdge is it allows you to see quoting activity. So out of all of the agents who use the CSG platform, it really breaks down how many quotes are being ran. So if you're interested in seeing what fellow agents are quoting, you can select different quote parameters and it will tell you how many quotes are being ran. But for this sake, I just really want to show you the Medicare demographics. So I think this is going to be extremely helpful for you to understand the market and really understand the changes that are happening in the market, as John mentioned. So when you do create a heat map, it's going to break out for you by zip code how many people are over age 65, turning age 65, and then how many are enrolled versus a Medicare supplement versus a Medicare Advantage. So really helping you pinpoint these areas of opportunity. So when you are buying leads, or when you are going into different community events, or looking at doing any online marketing where you can really pinpoint different areas of where you you want your ads to display, this tool can help you. So right now, as I mentioned, one of the features of the tool tells you how many quotes are being ran. So you can see in here, I'm filtering out by med sub quotes. So as I hover over a particular area, it's going to tell me how many quotes, what's the population over age 65, turning age 65, and then the med sub versus Medicare Advantage enrollments. Over on the left-hand side, I can filter that. So if I would rather it create a heat map for me based upon population turning age 65, I can change that. So now it's breaking down what zip codes have the most people turning age 65, and that's this month. So as I hover over a certain area, I can figure out, is this area more Medicare Advantage? Is it more Med Sup? Where should I focus? You can also zoom into a 5-digit zip code. So you can start out by 3-digit, and then you can break it into a 5-digit zip code. So you can see here how many quotes. Now it pulls in the median household income, population over age, turning age 65, Med Sup versus Medicare Advantage enrollment. So you as an agent, you want to make sure that you're going into areas, if you are pitching Medicare Advantage, making sure that those demographics make sense. And what we're kind of seeing more of, and we are seeing this kind of shift into more Medicare Advantage enrollments than Med Sup in certain areas. So this tool allows you to track all those changes as well that we're seeing, so you really know what's going on in the market and where you should be focusing your efforts on. So you want to make sure that you're buying leads in certain areas where there is a high population turning age 65, or if you focus on Med Sup, making sure that you're in areas where there's strong Med Sup policy holders. So use this MarketEdge tool to really help you focus your efforts. This is going to save you a lot of time, because you just don't want to go into an area cold or not understand the leads that you are going to purchase. Unfortunately, I can't tell you, our system can't tell you who these people are that are turning age 65, but we can tell you in this area how many people are turning age 65 this month, to again help you better position yourself within the market and what you're trying to sell. You can export all of this data into an Excel file. I love how the map is very interactive, so you can hover over the different areas. But again, if you are more of a numbers person, you want to break that down, you can export that all into an Excel file. So that's MarketEdge. That's tool, again, great for finding those areas of opportunity. Getting into those leads that I kind of mentioned. So if you are purchasing leads and you want a way to bulk quote all of your leads at one time, I have a great tool for you in order to do that. So we have a system called Client Manager. It is different than the MedicareCENTER branded CRM. So MedicareCENTER does have their own CRM. And then within the CSG quoting platform, there's this Client Manager, which is kind of another type of CRM system, but this does allow you to import your clients. So you can import your clients, or you can import those leads. We do have some great training guides on how you can import clients into here. You can also individually add new clients as well. But within each client profile, you can store some basic information on them. And then it does break down when the last time you quoted them in our system was. So you can see that. And you can also import any of their current products. So if they are currently on a Med Sup plan and you want to put that information into this tool, you can do so. You can also do it for any of the other quoting products that we support on our system. But what this Client Manager allows you to do is what we call a bulk quote or multi-client quoting. So after you use MarketEdge to figure out where those areas of opportunity are, once you get those leads, put them into the system here, and then what you can do is you can filter out your clients or your leads. So if you wanted to filter out clients based upon, you know, the med sup plan that they're on, or the carrier that they're with, or even their state or zip code. You can filter out by those different parameters, or you can individually select different clients here. So as I select these clients here, it's going to allow me to do a bulk quote. So what this is going to do is it's going to run a bulk quote for me. I'm going to choose my effective date, choose the plan. So if I did import any of those clients' plans into the system, I can select the current plan that they're on, or I can say I want to run a quote for everybody for a plan G. I can select the companies that I want to run this bulk quote for. So it's always going to return the 3 lowest premium options. So if I select all companies here, and I hit get quote, it's always going to return the 3 lowest premium options. So if I just wanted to see rates for a certain grouping of companies, I can just select those companies. Or maybe I want to run a quote for Ascendo for everybody. I would just select Ascendo and it would return results for Ascendo for everybody. So this is a easy, quick, efficient way for you to do bulk quoting for your current med sub clients and also any leads that you have. So you can see how quickly it returned rates for me for all of these individuals. So it is going to break down their current demographic information, the current carrier that they're on, what their in-force premium rate is, and then some additional options for them if they were looking to switch over companies or plans. So you could go in here, you could change this. So if you wanted to change this to a different plan type, you could certainly change it over here. If you wanted to go to the full quote results page, you can click on view all results and it will show you a complete list of all the companies that are in this individual's area. All this data can be exported too, so it exports everything into an Excel file. So if you wanted to do any mail merges, or saving any of those mass quotes, that's a quick and easy way to export the data. So use this. That saves you tons and tons of time instead of having to run multiple quotes for all of your clients. So as they're kind of looking for their different options, this is a great way for you to do that. What I also like about Client Manager is if you have any of your clients into the system, into Client Manager here, when you go and you run a quote for an individual, it would automatically populate all of their information in here. So when you do run a med sub quote or a Medicare Advantage quote, when you select, you have this client applicant drop-down menu. So you can just select a client and you can see here it automatically populated her zip code, county, age, gender, tobacco status, and that household discount automatically applied here. So it does become more efficient once you do import your clients into here. On the Medicare Advantage side and the Part D side, you can also save all of their prescription drugs and preferred pharmacies. I'll spend some time on that here in a second as well. So wanted to show you this med sup because I do want to show you how it works with the e-application as well. So what we've done at CSG is we have created a universal EApp platform. Essentially, that allows you to take an application right in our quoting platform without having to be redirected to the carrier's website. So you are already in our system running quotes. So why not just take the application on here? It's going to save you tons of time instead of having to get out of the quoting tool, sign into the carrier's website, rerun all of the quote information. It's going to save you about 10 to 15 minutes just right there, just switching over platforms. So since you're already here, you can just hit the apply now button and get right into the application. So we do have the EApp platform available for a handful of carriers. 3 of the major ones I would say is United Healthcare. We have Mutual of Omaha and we have Aetna. We do have some other companies like Independence American, Heartland National, Oxford. So we are adding more and more companies to this platform. But what this allows you to do here is no matter if you're taking an application for Aetna, for United Healthcare, for Mutual of Omaha, the look and the feel and the process is going to be the exact same. So we have a couple of options here. One, you have the apply now, which this just takes you right into the application. It will ask you to validate your appointment. So you will have to enter in your national producer number or your writing number to validate that you're appointed with that carrier. The second option is you're going to see an add to cart button. So we do have what we call a client shopping cart. And what this allows you to do is put multiple plans into a client shopping cart. So I hit add to cart. In the upper right hand corner here, I see that product here. So for Rita Franklin, I had a Med Sup in her shopping cart. Now I could go and I could also run a dental quote, and since I do have dental on our EApp platform, I can put a dental plan into her shopping cart, so then it's one checkout process. So I could go through, I could submit a Med Sup and a dental application at the exact same time. So it really makes it pretty easy and efficient to create a client shopping cart and have one checkout process with this. So I'm just going to kind of walk you through here. I'm going to do a Med Sup application, for example, just to show you what this is like. So it is trying to validate my producer information here. So that's what you see spinning here. We do validate all of your carrier appointments before it allows you into the EApp. So we do ping the carrier's database in real time to validate that. The first time that you try to submit an application on our platform, it will ask you to enter that writing number or that national producer number. The system will then remember it just so you don't have to enter it in every single time. So I'm going to give this a couple more seconds here to validate. Otherwise, I will just validate straight from this apply now button. But if you ever need to update your carrier appointments, in your e-applications panel is where you can update any of your national producer numbers or your writing numbers to validate that. When you do submit an application on our platform for the EApp, any incentives that carriers are running. So if Aetna is doing a promotion where it's, you submit so many electronic apps, you get a cash bonus. All of the applications that you submit on our platform are part of that. So rest assured, you're still getting all of those bonuses for doing any electronic enrollments. We also send all of the data to the carrier in real time as well. So it's just like if you were submitting an application on our system using the carrier's platform. It will take you right, submit everything directly to them. So now I am in this EApp here, and this is the AARP UHC application. But again, no matter if I was doing this for Mutual of Omaha or for Aetna, the look and feel and the process is going to be the exact same here. So it automatically carried over all of my quoting information over here on the right. So based upon the underwriting type that I select and my plan eligibility, it will populate the sections over here on the right hand side that I have to go through and complete here. I'm just going to quickly fill this out just so you can see what that looks like here. What I like about our application is it's going to underwrite in real time for you as well. So if I was doing a fully underwritten and I had to go through those different health questions, it's going to notify me if I answer yes to a declined health condition, or if I enter in a declinable drug, it is going to notify me of that possible decline. Some carriers won't even allow you to submit the application if you have entered yes to a declined health condition. Or have entered in a declinable drug. So as you can see here, I now have my sections over here on the right-hand side that I would go through and just go and complete. I have any initial documents. So if I wanted a copy of the enrollment kit, the guide, the application, I have all of those documents here for me. I can also send them via email as well. So you do have that option. And then your notifications tab, this is where I mentioned if there's anything wrong with your application, it will notify you in your notifications tab. So as an agent, you can just go through this, the process here. Once you have completed a section, it will have a green check mark letting you know that section is good. If there's a section that has a yellow error icon, that just means there's an error or missing data. So you just have to go through and complete that portion of it. As I mentioned, if I was to create a client shopping cart, which I bypassed that because it was still validating my appointment and I wanted to get right in here for you. It would carry over any of that individual's information. So if I did create a client shopping cart for that Rita Franklin, all of Rita's information that I have stored into Client Manager would automatically populate into this application. So it would have pulled over her first name, her last name, her mailing address, her email, everything. So that's what's nice about this, is it does communicate to the other systems within our tool. So it makes that process quicker in submitting the application. I'm not going to go through a full app start to finish here just for time, because I do want to talk through some of our other tools here that we have available for you. But feel free to get into the e-application platform. Just hit apply now, validate your appointment. You can get into here. You can practice going through here and seeing what these application is like to go through. Just don't go through the actual signature process and submit an app. But it's really easy to navigate. You can hop around to the different sections here. You'll probably notice there's no save button either, and that's because it is going to save as you are going through the application. So as you enter information in and hit continue, it does save out everything, so you can get back into the application. Each carrier is a little bit different on what they allow for signatures. So almost every single carrier, we have the email signature option. We also have an in-person signature option where you can provide them their mother's maiden name and the last 4 digits of their social security number as their signature. Some carriers have the text option available. So we just kind of, depending on which carrier, we have different signature options for you as well. So all of your incomplete applications will automatically store into your applications panel, where you can see here I do have some different applications that I've started. So if you do get into the platform, you just want to get familiar with it, just after you're done, just hit delete and you can delete out of it. Or if you were going through an application and you had to get back into it, you can just hit edit. Again, we have some great tutorial videos on our e-application. So if you are interested in any of those, you can always head to our website, csgactuarial.com. Underneath our learning centers, we have all of our e-application demos housed. John, have any questions came in so far on anything that I've discussed so far that I could answer here quick until I jump into the Medicare Advantage in Part D?
Yeah, I had to figure out how to demute myself, Anna, but yeah, there's a couple. One is actually a reference to the fact that the screen wasn't updating for this individual. I think that was part of the downtime. The other one from Kim is asking us, do we need to do a paper app the first time using a carrier before being able to do an e-app?
No. So as long as your appointment information is up to date with that carrier, you can get into the e-application platform.
Yep. Second one, what's the website for training? We'll make certain that we include that in the follow-up, but a quick little burn through with CSG's URL.
Yep. So our website is csgactuarial.com. And if you head to the csgactuarial.com, in the upper right-hand corner, we have our training center. And then all of our e-application tutorial videos are under the e-app tutorials. And I think there may be a delay in what I'm sharing. I don't know if you're seeing that too, John, or not, yep. But
yeah, we're peeking at basically the menu of tools that are within CSG is what we're looking at. So, that's the challenge we have with the joy of the internet. Sometimes what's
no,
that?
It's trying to right, it's trying to keep up with me here.
Yep. Another question, I'll throw this at you really quickly, Anna, is with UHC, how about the ERP requirement? Will that still be required in this process?
Yes, it will. So one of the first questions on the United Healthcare is that they have to have an AARP membership. So if they do not have one, we do provide a link for them to apply or for you to look up their number.
Yep. And that's with both AARP supplements that are now out and available as well. So not available
Yep.
across the country, but does it cost money to become a subscriber to CSG?
No, it does not. So that's part of your being a Premier agent. You do get full access to the CSG platform.
Awesome, without cost. So let's see.
I paused it here just so I could I could try to get back into there and show my screen, but it looks like there's still a delay going. This is our website, csgactuarial.com. I think you can see that pulled up here. If you hover over that Learning Center on the far right, that's where we have all of our tutorial videos. So anything that I covered on that, it's going to be located there.
Awesome.
Yes. I'm going to
Okay.
see if I can get my internet to cooperate there with me so we don't have that lag time there. Were you seeing that during the presentation, John?
Yeah, it was thinking a lot.
Oh, bummer. Okay.
Yep. Let's see,
Let me
another one.
see if I can.
I have contracts through 2 different uplines that are both premier companies. Will MedicareCENTER show all the carriers I'm appointed with and automatically track through the proper uplines? Tom, that's a yes. And it's actually extended beyond that. If you are also contracted with any of our integrity platform partners, those will show as well. So I stepped on you there a little bit. Let's see here. Enrique is asking, can you do groups?
So we do not have group quoting. Is that
Yep.
probably what's in reference? Yeah.
Yep.
We do not do any group or ACA.
Okay. And the Deborah is asking, do we need to sign up for CSG? It is a process that you go to the website for MedicareCENTER. You log into that. You have to create a login for the MedicareCENTER piece. It automatically then pulls you up access to CSG, once again, without cost, Deborah. So it doesn't cost you anything for it. So that's kind of a yes and no question. You have to log in through the MedicareCENTER piece, and it automatically, since that's a single logon, will put you in the go for CSG as well. And thank you, Enrique. He did verify the fact that that was indeed the question. And I think that's, so what we're seeing right now is
You're
the,
seeing our tools.
yeah, the menu once again. So.
All right. And I'm trying to get into I do want to cover here briefly, and I don't want to sign out of here, but I'm trying to get my internet here to update so that speed's a little bit quicker here, but I'm sorry that is happening. Okay, so now here on the screen, I'm just going to focus a little bit over to the Medicare Advantage side. So we do have a new V2 beta is what you would see when you are running the quote, but this allows you to enter in an individual's prescription drugs and preferred pharmacies for the Medicare Advantage and Part D quoting. What this allows you to do is that when you have your client, you can select a client from your client applicant. So you will have to select the client first. The first time that you try to do a quote for a client, you will have to enter in their prescription drugs and their preferred pharmacies. So when you scroll to the bottom, the second time that you go and you run a quote for that individual, those prescription drugs and those preferred pharmacies will automatically pop populate in there for you. So you don't have to re-enter them in every single time. I do know that has been the biggest struggle for a lot of agents when Medicare.gov changed all of that, being able to store prescription drug and pharmacy data. So our system does allow you to do that, and we do that through the client manager. So as long as you have those individuals entered into client manager, you can select that client from the drop-down menu, and those prescription drugs and those preferred pharmacies automatically populate. So you can do different fill method, whether that's retail, mail order, or both. Again, on here you have different options for sorting if you wanted to sort by annual drug and premium cost or annual drug deductible. You do have some different options for sorting. For plan type, if you just wanted to do Medicare Part D, you can change your plan type to Medicare Part D as well. I know sometimes agents don't know that that's where our Part D is housed under, but it is housed underneath that plan for Medicare Advantage. So you could change that there as well. So if you haven't used our Medicare Advantage quoting, this is a newer version of it. So it is going to start breaking down for you the costs for all of the drugs. It's going to return here. I still am seeing a lag here, but it's going a little bit quicker than it was earlier. Thank goodness here. But on your quote results, it will show you based upon the drugs that you entered, how many of those drugs are covered, what are the costs of the different pharmacies. One of my biggest things that I like most about our tool, comparing it to other quoting systems, is when you click on the plan highlights, it is going to break down for you county enrollment and company enrollment. So early on when I was talking about the MarketEdge tool, how I mentioned to you it breaks down those Medicare demographics, this tool also does that. And this is helpful for you. So all you would have to do is click on that, the plan highlights here, and you can see here up on the screen now that it shows you out of everybody in this county how many people are eligible for an MA plan, and then based upon that how many are enrolled. So you can see in this county in particular there's about almost 47% of this county is made up of a Medicare Advantage. And then we can then look at the company's enrollment. So how many people are enrolled within this particular company and then this particular plan for this company. So it breaks down a lot more demographic information for you, which can be extremely helpful. I know a big question is always, well, how popular is the plan that I'm on? So that feature can kind of help you, and again, help you better understand the market, better understand how popular plans are, how many people are eligible for an MA, and how many are enrolled. And then once you click on the plan details, this is where it's going to start breaking out for you the overview, the benefits and the costs, and then also start getting into the RX drug coverage and costs. So for each particular drug that you entered, it will break down the cost for those drugs, the tiers, and then it will also break down the retail costs before deductible, after deductible cost, and then the estimated cost each month, and then it will break down the coverage phase that they're in. So if they're in their gap or in catastrophic, it will break out that coverage phase for you. So this is a new type of Medicare Advantage and Part D quoting that you also have the option for to use within CSG.
Awesome. 2 additional questions and an observation from myself before it rolls out. It'll be interesting to see how this updates with some of the relabeling of the Centene subsidiaries all being branded WellCare going into next year, how some of that will reflect in the description in all of these programs. But a question from Cynthia speaks to, for quoting the MAPD PDP programs, will it give you the RX cost for all carriers, even the ones you're not contracted with? So a total representation of the market or just contracted programs?
Yep. So within the CSG platform, you will see 100% of the market. So you will see all plans. I know there are other platforms that you may use that will only show the ones that you're contracted with. We will show you everybody.
Okay. Another one just popped before I got to the other question, but I'll throw the other question out first. And that is basically, um, does the system require that all of that data be entered in individually, or is there a way to group dump, so to speak, the data for clients into the system without doing them one by one?
Yeah. I wish there was a way. Unfortunately, there's not. You will have to do each individual one. But the good thing is once you do it one time, you won't have to do it again for that individual because it will automatically save all those
Okay.
drugs. So just spending some time in the initial, and then the next time it'll make things a lot easier.
That means for 2 weeks in September, we need to giddy up. Another question from Monty: will we be able to also enroll Medicare Advantage products from this site, like is available with the SUP plans?
Yep. Soon you will be able to. That is something that we are really focused in on at CSG, is expanding our e-application platform. So in the future, you will be able to do Medicare Advantage enrollments on here. Unfortunately, it's not available today, but we're keeping our fingers crossed that we could hopefully get a carrier out for you by AEP. But again, we're kind of working on expanding our EApp across multiple carriers and across multiple product lines. So in the future, you will definitely be able to do Medicare Advantage enrollments on here as well.
Will that also, you feel, Anna, with those advancements coming forward, include the health assessment programs that are coming in there, or will that be another trip down the yellow brick road later?
Yeah, the health assessments has been a popular question. Any of the carriers that are doing those health assessments, those are taken, they will reach out to you afterwards to complete those. So right now it's not part of our e-application platform, but I'm very intrigued on, is there a way that we can incorporate that into our system? So that is some feedback that I've shared with our team as a future enhancement.
And a couple of them do allow it, and a lot of them in the past had pushed us to use the carrier's e-app instead of the systems, and some of them are addressing that issue, so I'll be curious to see. Another question: will you have the option to enter doctors and check if they are in network?
Yeah, that's a great question. So that's a new feature that we hope to have launched by AEP as well, where you can enter in providers and it will
We lost you there, Anna.
tell you whether or not they're covered or not. I've seen some great demos on that, so that is coming in the very, very near future.
It'll be interesting to see, because even the plan finder on Medicare.gov, there's challenges with that as well, where you have to leave the system, go to the carrier to investigate. A couple of the other platforms are trying to iron that out as well. So we'll see how that works. But that's an ongoing challenge, regardless of the fact that it's a requirement that the carriers keep that updated with the systems. So, and all these we
Right.
pull from Medicare anyway for that data in a lot of cases, but it'll be interesting to see. So that's the
Absolutely.
questions. Let's see. Any other thoughts? I've got a couple slides that we'll ask you to kind of address maybe as we go through. So if you
Yep.
don't mind, I'm going to pull control back,
Go for it.
and there we go. We have your lovely visage on there. I'm going to whip it in here because it's an interesting point to note that this tool is available on a multitude of platforms that you can use, from your desktop, your laptop, your iPad, even your smartphone. Smartphone, you have to have better eyes than I've got, but it's there for you to use. The e-application process we've kind of spoke to. We've mentioned the MarketEdge program. That's a great place, and we got live data on that. This is a neat system. I really enjoy this piece of it because it allows us to go in a household, and if the base program is a Medicare Advantage program, they're not going to pull into another platform or another carrier. It's a nice way to fill in the gaps with the hospital indemnity, fill in the gap program. Great way to do it. We do have a demo on this that'll come out as well. We neglected to speak to the scope of appointment.
We do have an option for
Medically.
you to do those. the electronic scope. So that is an option that you can do, and you can store them all within our system as well.
Okay. Another question popped up. Will you be able to do a VBE if enrolling in a Medicare Advantage plan in that system? That's what we were just speaking of, Buford, that not at this time. We hope to see that in the enhancements coming through. We talked about this is a neat piece to come into play, particularly now, but during AEP as well, in order to make certain that we properly address an individual's beneficiary's situation, to make certain that we're incorporating in the low income subsidy, the extra help programs, to properly compare the programs that are being offered. That's a great tool that's in there. The Medicare supplement piece, I really enjoy the fact that this program not only gives us that ability to give a complimentary Medicare supplement review, but it also then gives us an idea of making certain what carriers we need in our portfolio. And then, of course, the shopping cart that you mentioned. And there we go. So we'll close with just a few slides here as to why you want to utilize this program through Premier Marketing. We do offer a number of other programs that can help you, particularly if you're looking to contract with multiple ancillary carriers. This gives you an opportunity with Insurance Bay to create your agent profile, store your errors and admissions coverage, answer the questions that are commonly asked during the enrollment process, have them there so you can just click and complete a contracting appointment as well. Back in the old days before the internet would just made life easier, when I was a carrier rep, we had over 80% of our applications pended on paper because people can't read our handwriting. It's the same way within the contracting situation as well. We do offer discounted E&O for qualified agents. What makes you a qualified agent? You got to contract with us. And it is a program you own. So it's not like you're being added to a blanket E&O for just one policy or one program, and you have to worry about how you're going to fill this requirement for everyone else. Fairly priced program that enables you to satisfy that requirement across the board. We do also help with continuing education programs through our association with WebCE to make certain that your license stays into play. And you can actually add to your own benefit package through a modified guarantee issue policy for disability income, where you're paid a commission on business for yourself and you fill that need within your own benefit package. Excuse me. And where today's presentation is being recorded, we've also recorded the multitude of programs that we've done in the past, including ways to get in front of people to offer all these wonderful programs and to use the system that's come into play. Deborah, VBE, I believe, is the health assessment program, to the question that popped. MedicareCENTER, this is where I reemphasize the fact that this program is available to you without cost with a contract with our organization or one of our sister organizations. Great way to make certain that you utilize a tool that's out there to help you be effective and cut down on the windshield time or those second appointments where you got that, I got to talk with my wife, I got to talk with my kids, whatever it happens to be. If that appointment's a 40-minute trip away, well, gee, you can do it electronically and take care of it, collect that scope of appointment by multiple means, and store it for that 10-year program, whether you sell a 10-year period, whether you sell that individual or not, as is the requirement. Many carriers and systems for certain products will offer you additional incentives that may include trips as well, in addition to the marketing allowances, as they're phrased in the Medicare supplement world, that we've seen in the past, and take care of that for you. It's all on one spot on our website, so you can make certain that you're getting all the compensation to which you're due, and that in many cases allows you to also cash in on different incentives that we offer through Premier Marketing. We do have different ways of getting in front of people as well. Contact list. You can't cold call for MA or PDP programs, but you can for MedSup and those ancillary programs. We're seeing a lot of folks dial on 63 and 64-year-olds for dental because you have a price increase at 65, a great incentive for them to enroll earlier into those programs. Since they're all fee for service, they pay on top of everything else anyway, and it builds your T65 pipeline for you. We've got these other systems that are in play on how to effectively work the retail programs, faith-based organizations within your target market, provider marketing as well. And many of the carriers will generate prospects for you, particularly in the MA and PDP arena. We want to make certain that we leverage our influence with these carriers to make certain that you're getting everything that you can. We do have internet leads available as well, in addition to direct mail support. And that lead program for direct mail, it's two-pronged. You can qualify for it twice if you sell final expense. We use preferred lead vendors because we vet the letters that are going out in order to cover our combined CYA initiative, because we want to make certain that we stay compliant. We do have two different programs that help you if you want to do just mail responses, not controlling the entire system that the direct mail programs require of you. So you can actually buy returns. Keep in mind, as soon as someone replies on a direct mail that you control, you see that immediately. That lead may be 3 or 4 days old. It is not contacted by anyone else, but you know what happens the cooler a lead gets. We do also have the internet lead program through Facebook, one for final expense and for Medicare as well. And we've developed a program to help you remember to ask for referrals. And that includes the folks that you're visiting with now, but also the book of business that you have in play. Hey, I'm your agent. You know of other people that I can help. We still have to abide by the do not call regulations, but it's a great way for you to work through systems. And we do all this because we want your business. Much as where you want to be referable, we want to be referable as well. We've got great people in Norfolk that take care of you. And we want to make certain that we're able to make this system a essential tool for you to use that helps you leverage your entire personal marketing program. And as they say on the John Wayne movie Cowboys, slap a piece of bacon in that biscuit, saddle up, let's ride, because we're burning daylight. It's a program you can use now, so don't delay. All that said and done, I'm going to check questions one more time. Let's see, there's one more that popped. Is there going to be, whoops, I'm going to have to pop this because my eyes are not used to that font. Is there going to be a different website for the 22 platform like there was for 21 from 20? So the same system will be there and the enhancement should be right in that same system. So not really. All that said and done, you can reach out and visit with us at 1-800-365-8208. If you're working with a marketer now, they're going to help you with this system. If you're not, we're going to set you up with a subject matter expert in order to make certain that it works for you. You can also reach us through our website at premiersmi.com or respond to the email we're going to send up as part of the follow-up to today's presentation. Right at the top of the hour, I'd be remiss if I didn't thank you for the time that you've invested with us today. Thank Anna for her help. Thank you as well for the folks that have done business with us in the past, and for those of you that are about to do business with us. We thank you for that. So all that said and done, until we're able to visit with you once again, we wish you good selling. Thanks so very much. We'll talk to you soon. Thanks, Anna.
Thank you, everybody.